Hi, this is Kelly Mayer, and I am doing my final web report on the future of healthcare, which I believe is telehealth, telemedicine, and telecare. The future of healthcare is really becoming a blur with traditional healthcare boundaries with this latest inspiration and innovation with telehealth medicine. I think that healthcare will no longer exist as it does today, fundamentally shifting from healthcare to health. Focus on wellness managed by computer technology of today into tomorrow, I think is going to be the biggest change with greater connectivity, interoperable, secure platforms, and increased consumer engagement, especially with these data and platforms. And looking into the fact that last year alone, over 7 million patients used telemedicine, which is pretty incredible. There are some issues still with lower reimbursement for this type of care. Rates that are looked at with current lack of interstate licensure limit some abilities of providing healthcare with telemedicine. There's definitely different ways to deliver healthcare these days. Looking at the telehealth aspect, that is using digital devices such as computers and mobile devices to access healthcare services remotely. This is extremely beneficial for rural communities. I have to say, I was just at a tiny parade, hometown parade in Sedalia, Kansas on Friday night, Sedalia, Missouri, excuse me, on Friday night. And one of the parade floats was actually said telehealth, the future of healthcare, and I couldn't believe it. And it showed an older man in a suit from like the 1800s, and then it showed a young doctor on a phone, and an elderly gentleman next to me said, "Telehealth, the healthcare telemedicine of the future. They think that they're going to diagnose me while they're on the phone." He says, "Heck, they can't even diagnose me when I'm in the office." So I thought that was a pretty funny aspect to just have had witnessed that, knowing I was going to be doing this on telemedicine. Anyway, the telehealth is also distributing health-related services, as I state in here, for long-distance patient and clinician contact, doing care advice, reminders, and remote admissions even. Some other examples of telehealth are education services, remote monitoring of vital signs, remote doctor-patient consultations and diagnoses. I recall even being on a monitor when I was pregnant for premature contractions, and it was followed up into a phone line that showed if I needed to go into the hospital to get checked, and that was many, many years ago. So this just keeps expanding. They've got remote detections of fluctuations in medical conditions, and also, of course, allowing for e-prescribed medications and treatments. Telehealth patient portals allow doctors to communicate with patients directly and request follow-ups. As I state, communication with scheduling, prescriptions. I mean, it is just unbelievable all the different ways that telehealth is improving our healthcare, starting now, which is just going to continue to increase in the future. With wearable devices that are recording and transmitting heart rate information, just as we've seen a lot recently with Apple and smartwatches that are able to let patients know that they have a fib, and patients that have never had knew this about themselves and are calling their doctors and then finding out, yeah, that this portable device on their wrist actually has accurately detected a fib. Allowing patients to stay in their home longer with dementia by actually having tracking sites on them that upload and show if they're going somewhere where they wouldn't normally go, or they've had a fall, and it alerts medical care team units and even family and loved ones. Telehealth is just going to completely continue to improve opportunities for better quality of care, more efficient, and allowing patients to stay closer to home. With telemedicine, there's different types considered storing, forwarding, and remote monitoring with real-time interactive services. The telemedicine is allowing for a decreased rate of cost per visit, that's for sure. It became approved in 2018. Some issues with that are still having Medicaid approve certain types of telemedicine. I think that will just improve over time when people say it's more cost effective. Telecare is actually the technology that allows patients to maintain their independence utilizing these mobile monitoring devices and medical alert systems. It's telemedicine and telehealth are so important to us because, like I stated, access to care, cost-effective delivery, distribution of limited providers. That continues to happen because of the decrease in number of primary care physicians. So this will allow primary care physicians to be able to see actually more patients with reducing amount of staff that they might need at their office, just able to do it themselves and cut down on costs that way. And like I talked about earlier, there is some low reimbursement curtails to telemedicine, with Medicare having spent only $14 million on telemedicine service last year, which is less than 0.01% of their total spending services. But again, I believe this is going to increase as time goes on. Telemedicine actually began in the 1900s with transmissions of heart rhythms over the telephone to the radios. And then consultations started in Europe. And the first radiographic images were actually transmitted in about the 1940s between two cities in Pennsylvania. These are my citations. And I also was going to share, I've got a little Christmas jingle for telemedicine, telehealth for the future. 'Twas the night before Christmas, Kwanzaa, and Hanukkah, and all through the rural town. Not a PCP or NP was stirring, not even a specialist was around. The patients were nestled all snug in their beds with visions of new diagnoses all in their heads. And Mama with her Flomace and I, my CPAP, had just stopped snoring for a long, peaceful afternoon nap. When out on our phones, there rang endless clatter. I stumbled elderly from my bed to see what was the matter. Away to the PC, I flew like a flash, tore open my email, and gave it a pass. The message that was left on the new web portal gave me light and hope of being immortal. When what to my eyes should appear a televised PCP with stethoscope in ear. With a webcam and phone I hooked up so quick, I knew in a minute it was young Dr. Nick. Thank you all for watching my presentation, and hope you guys have a great holiday and take care.